Greeting viewers, thank you for joining us today. We appreciate you immensely and do not take it for granted that you have spared your time to engage with our programs, particularly today. Today, we are discussing an issue that may have impacted you or a loved one in one form or the other. We hope that at the end of this session, you will be empowered and fully equipped with helpful resources to manage any future incidences. Some basic information to note as we progress with this dialogue is that this program is being recorded and will be available on our YouTube channel in the coming week. Our handle is Columbia Global Centers, Nairobi. As we proceed, please post your questions under the Q&A section. We encourage you to engage the panel, so keep those comments and questions flowing. The moderator will direct them to the panel at the end of our session today. Follow us on social media. That way you will not miss any of our upcoming programs or even exciting opportunities pertaining to education or research. Our handles are at CGC Nairobi for both Facebook and Twitter. Again, that is at CGC Nairobi. For Instagram, our handle is cgc.nairobi. I would now like to welcome Dr. Durango, who is the Director of Columbia Global Centers, to open our session. Welcome, Dr. Durango.
Thank you very much, Lynn. As Pauline has said, my name is Murugi Durango, and I'm the Director of Columbia Global Centers, Nairobi. I welcome you all, and thank you for joining us for today's event. Let me just tell you something small about our center here. CGC Nairobi is the Eastern and Southern African regional hub for Columbia University. The center collaborates with Columbia University faculty, students, alumni, and our local partners to create research, scholarship, and teaching opportunities. Through these engagements, the center also hosts public programs to engage in dialogue on pressing issues such as what we have today. Today, CGC Nairobi, in partnership with Columbia University School of Social Work, the Organization of African Youth, Elimu Trust Kenya, and the International Peace Support Training Center, welcomes you to our webinar, COVID-19 and Sexual and Gender-Based Violence. Beyond the raging COVID-19 pandemic that we are currently experiencing, society is witnessing a startling upsurge of the shadow pandemic of violence against women and in increasing cases against men, coupled with rising rates of gender-based violence cases in various settings, including virtual platforms. With the devastation of the pandemic, there has never been a more critical moment to consolidate support, resources, and commitments to address gender-based violence. Today's conversation will delve into these issues and will be moderated by Albert Migoa. Albert is a trained counseling psychologist, counselor with the Red Cross, and an emotional intelligence facilitator. You will be in very, very good hands with Albert leading this conversation. And let me now invite Albert to introduce the panelists as well as start off the discussion. Welcome, Albert.
Thank you very much, Madam Durango. Viewers, hello once again. My name is Albert Migoa. I define myself as a hybrid professional, and my hybrids, as has been mentioned, are I'm an emotional intelligence facilitator, I'm a psychologist, I'm also the chairperson of the Internet Society Kenyan chapter. Now, today's discussion is one it will be a very stimulating discussion, and going by the rising number of cases globally, as has been witnessed, which is gender-based violence and sexual harassment during COVID-19. We've got a very rich panel, a panel of well-experienced and versed people. So I urge each and every one of you to come into this conversation with an open open mind and an open heart, willing to learn, question, and pick on what we can pick to go and make a difference. So without much ado, I'll quickly mention the panelists for today before we kickstart the session. Our first panelist will be one Sarah Oganda. Sarah is a youth representative from the Organization of African Youth, and she'll be sharing a case study of gender-based violence in public transport. Welcome, Sarah. Our second panelist will be Mr. Wathome. Mr. Wathome is in charge of directing staff and is the gender focal point person at the International Peace Support Training Center. And he'll be looking at the overview of sexual gender-based violence, a situational analysis, response mechanisms, and prevention. Our third and final panelist will be Professor Samantha Winter from the School of Social Work at the Columbia University. And she'll be looking at a multi-sectoral approach to sexual gender-based violence, response, and mechanisms. Now, I'd like to once again reiterate that as the conversation goes on, kindly present your questions and your comments on the chat box, which we are going to address at the tail end of the conversation. Now, before we begin, we'd like to share a 2-minute video just to set the tone for the conversation of the day. Over to you, Pauline.
What is gender-based violence? Gender-based violence, or GBV, is one of the most common and widespread human rights violations. GBV is violence directed against someone on the basis of their gender or sex, which results in physical, sexual, or psychological harm. These acts violate an individual's human rights. GBV is most commonly perpetrated by men against women, girls, and other vulnerable people. However, men can also be victims of gender violence. Who are the perpetrators? Non-partner violence is violence inflicted by someone you do not know well, like strangers, acquaintances, or colleagues. However, violence is generally perpetrated by someone you are close to. This is known as interpersonal violence, which is perpetrated by either a friend or a family member. Intimate partner violence is perpetrated by someone you are in an intimate partner relationship with, a lover, spouse, or an ex-partner. What are the different types of violence? Physical violence is the intentional use of physical force or threats of violence. From a pinch to a punch, any act or threat of violence is damaging, whether the damage can be seen or not. Sexual violence is forcing, intimidating, or even tricking someone to engage in any sexual act against their will. Any sexual act with someone who is unable to understand what they're doing or is unable to consent because of their age, an illness, disability, or the influence of alcohol or other drugs is sexual violence. Forcing a lover or spouse to engage in sexual acts is a form of sexual violence, either called marital rape or intimate partner rape. Sexual harassment is also a form of sexual violence that can either be verbal or physical. It occurs in private and public spaces, such as schools, workplaces, in the streets, and on public transport. Economic violence involves denying a person access to their money, economic activity, or other basic needs by either controlling their finances or stopping them from achieving financial independence. All these forms of violence may lead to emotional and physical trauma. Emotional violence can also include verbal abuse, humiliation, and controlling what a person can and cannot do. Emotional and economic violence are as equally damaging and disempowering as sexual and physical violence. These types of violence are often misunderstood or ignored by people, even those we turn to for help, like the police, the courts, and other support structures. No matter who you are, where you live, or who is inflicting it, GBV is never acceptable.
Thank you very much for that video. As you can see, viewers, GBV is an issue that requires our attention, and it also requires urgent address. Now, I'd like to emphasize that before I invite the first panelist, that each of the presentations will take a maximum of 10 minutes each. Now, I would like to now welcome our first panelist, Sarah Oganda. Sarah, the floor is yours.
Thank you very much for this opportunity. So we're going to have talk about a case study on sexual harassment, specifically in public transport spaces. That is the niche that we decided to go into. So I'll go right in. So the reason as to why we chose to do the research on just sexual harassment in public transport spaces was because this is an issue that is there, but a lot of people do not consider it as an issue yet. So that's why we decided to go into it. So my bio has already been well explained and said, so I'll not go into that. So yeah, why we focus on sexual harassment in public transport spaces is because there's little awareness on matters of SGBV that occurs in public transport spaces. Again, there's little data on it, and there are less guidelines and vague policies governing issues of sexual gender-based violence in public transport spaces. So I'm going to present to you a case study of one of the cases that was very touching as we were going through the assessment. One of the people shared with us, and this is what this is their story. So I'll just give you their story. So Julia is the girl's name, but Julia, whose name has been changed to protect her identity, is from the eastern side of Nairobi, Kenya. Julia, who speaks with a small, faltering voice, tries to smile, but this does not quite erase the pain in her eyes. She looks away, scratches her short hair, then she leans forward. Tears start streaming down her cheeks. Then she pulls out her shirt to wipe her tears. The rape experience changed everything. To be honest, I am not the same person. He finished me, she says. So this is what happened on the fateful day. Julia was walking home one evening at around 6:45 in one of the slum areas in Nairobi. This was after spending the evening with her friends. She had to get back home to prepare for the new week ahead. She made a living hawking a few items within Eastlands, and sometimes she worked as a kamagera. For those who might not know who a kamagera is, these are touts who are stationed at particular stages to help the main conductor fill the vehicle. She felt that time was moving fast and it was getting darker, so she decided to board a boda boda. For those who still do not understand what a boda boda is, these are bicycles or motorcycles used as taxis for carrying passengers or goods. This was her experience. The boda boda rider requested Julia to allow him to stop over at his place to quickly get a jacket, then they would embark on their journey. She agreed to this request. As soon as they got into the compound, the rider quickly alighted and rushed back towards the gate and locked it. She then pulled her hair and dragged her into the house. He threw me on the bed. So this is her narration. He threw me on the bed, face down, pressed me down with his great weight, then turned me over on my back, tore open my shirt, jacked my bra up around my neck, and zipped my skirt and pulled them down as far as he could. Over the next 3 hours, he raped me and tormented me with description of how he'd kill me using a knife, telling me exactly where he would cut me. He covered my face with a pillow and pressed it down so that I could not draw a breath nor shout out for help. Each time I expected to die, but he always relented just before I lost consciousness. This was the aftermath. This is what Julia went through after the rape. When I got home, I collapsed in the shower, bleeding and thinking only of the ordeal I had gone through. I got up the next morning as usual, cleaned my bruises using warm water and salt, and left for work. About 2 months later, I was struck down suddenly by unbearable abdominal pain. I threw up profusely. I started to bleed everywhere. I passed out, she said. She realized that she was pregnant with a baby boy from the rape. She also had complications around fistula and a damaged vagina as a result of the rape. This man had destroyed both our lives, she said. Why did she not report? That is a question that we'd all be asking. In the first few months after I was raped, my brain went numb. I dissociated and forced myself to forget the incident. I decided then not to report my rape. I just wasn't high function enough to have the thought to go ahead to do it. I knew that a child would be born out of the rape, and I was careful not to get my child discriminated by the society. I have never shared this story with anyone. So this was the first time she was talking to me as a researcher about it, and it was something she went through, and it was very traumatic. So the cycle of stigma and shame, what she went through after. I became suicidal. I was too toxic for those around me. I hated all men, and I lost several friends. There was no life left in me. I completely withdrew from the society. I stopped working. I spent weeks in my house, hardly eating as depression overcame me. Many a times, I sat on the balcony contemplating suicide. I became a shadow of myself, barely eating, always blaming myself for wearing a short skirt that this might have triggered him, she said. It was a short story, but it could tell us, we could get an overview of what it is to be raped on transit, on your way home to work. So as I finish, it was a short, sad story, but as the fellow panelists would continue to make their presentation, this would just make us understand the weight of the problem that we have. So just a disclaimer, in case of rape, anyone who is here attending the session or knows someone who could go through this challenge, first, this is what you need to do. Visit a health facility for a checkup and treatment. Number two, you need to report to the police station for legal action. That is the end. Thank you very much for your time.
Thank you so much, Sarah, for your presentation. Very precise and succinct and just to the point. I tell you, it's really an emphasis on what GBV has done and what it can do. You can see who the victims are. You can see there's fear. That's why it's not reported. Fear,
Yes.
stigma, even understanding and knowing what referral pathways one should use. It's a big challenge. I feel for that young girl, but for me, she's a representation of many other young girls and now even boys who are going through something very similar. Now, I'd now like to bring in Mr. Wadhome, who will now take us through the situation analysis, response mechanisms, and prevention. Over to you, Mr. Wadhome.
Thank you, Albert, and thank you, Sarah, for that opener, giving us an incident that points to many happenings, not just for girls, but also for women and also for adult men in our society. What Sarah included with the challenge of tackling gender-based violence, the challenge that many people are going through, that especially in this context, the African or Kenyan context, that GBV cases are underreported, yeah, or they are unreported, and so they are unresponded to. So whatever statistics we get, it's just a tip of the iceberg, and it's a challenge to the fight against gender-based violence in our society. Right. Allow me to share my screen. Okay. Okay. These are my initials. They were said. And the video at least gave us the background of what is GBV. And as we know from our learning and our interaction, GBV is that violence that is done or committed against you because of your gender, because you're a man, because you're a woman. And so this violence is meted on you. And we have to appreciate the different forms that were also mentioned in the video clip that we saw. the physical violence, which is very common, emotional, which arises out of the commission of the other types of violence. Sexual violence is very common, and that is why this webinar has the bit of the title, reading sexual harassment, which also Sarah did intimate to, economic violence. And now to add to our discussion is looking at the harmful traditional practices in our context in Kenya, in the African context. The harmful traditional practices stand out and are discussed as a form of gender-based violence, because we are talking about female genital mutilation, among other harmful traditional practices in our African and Kenyan context. Then now we link, because we are discussing or deliberating upon gender-based violence in COVID-19 times, or during the pandemic period. And usually any type of an emergency or a crisis becomes a fertile ground for gender-based violence. Like where I work, because we deal with the peace support operations, we are talking about conflict-related sexual violence, for instance, in areas where there's a conflict, like DRC, Congo, and many parts of Africa. So crisis often results in some fertile ground for gender-based violence to thrive. And so it is the COVID-19 crisis, which because of the way countries have responded, because of the way communities responded, because of the restrictions that came with it, because of the economic impact, it led to a surge. And that is a common thread all over the world, that it led to a surge in COVID-19 due to as one of the effects of the COVID-19. And the obvious reasons, this is a chart from the UN Women, which appreciates that before the pandemic, we're talking about 243 million women and girls, 15 to 49, who were experiencing sexual and or physical violence by intimate partner, that is the intimate partner violence. But since the pandemic, the violence has increased, seriously increased, and I'll be showing some numbers. But we must appreciate the reasons why the violence has increased. A multiple of factors have led to this increase in the GBV in our setups, whether Kenya or elsewhere in the world. Issues of economic impact of COVID-19, loss of jobs, loss of business, loss of income, and the stress that comes with it. Cramped living conditions, yes. The restrictions or the protocols, the guidelines demanded at some point, depending on which country you live in, that people do not move, and that restricted people in very small areas, small spaces they were not used to, and so violence had fertile ground. Isolation with abusers, obviously, if you stay with an abusive partner, then because of the COVID-19 requirements, then you remember people had to stay together longer with the abusers. And sometimes the curfew time meant that you cannot run to the police station, or you cannot even run away to seek help. And so you are so confined for longer with the abuser. Obviously, movement restrictions, which I did intimate. And also, remember, important or crucial services during some times of lockdown and curfew and other restrictions were limited or were not accessible. And so people were suffering more than ever before the pandemic. You can look at this. For instance, in 2020, because these surveys or survey reports are comparing 2019 before pandemic, and 2020 after the pandemic was declared. in the Sahel region, the countries that are in that cluster, there was a marked increase of 12% in GBV cases reported compared to 2019. In the context of our country here, the host, that 5% was reported as an increase. That is compared 2019 and 2020. In South Africa, that's 7%, you can see. And in CAR, Central African Republic, we had 69. Very serious, because CAR is unique. There is a conflict that is going on, and now there was the addition of the COVID-19 pandemic adding to the crisis. So you can see that marked increase in GBV cases that is as a result of the pandemic, COVID-19 pandemic crisis. And the common forms of violence were physical violence and sexual violence. And we need also to mention that there was marked increase in teen pregnancies, in teen marriages, in female genital mutilation, and also the commission or the performance of other harmful traditional practices, especially in the African context of the COVID-19. Okay. Obviously, we are here not just to talk about the problem. We should ask ourselves, what can we do? We should talk about prevention. And if we don't prevent, then we should talk about response. And I'll be doing part of that. And then Prof will do the last bit of the response mechanism, appreciating multi-sectoral approach. Basically, there are different strategies or approaches to prevention. One of them is this model, which takes a more like a medical model to prevention, looking at the primary, secondary, and tertiary prevention. We can also use the ecological model, looking at the different actors or the different stakeholders in that ecological model, and then ask ourselves, what can be changed to prevent the occurrence of gender-based violence in those different spheres of the ecological model. When we use the three levels, the medical model of primary, secondary, and tertiary prevention, primary activities are very important, or primary prevention is very important, because it forestals the occurrence of the violence. What can we do so that this violence does not occur? Maybe at the personal level, maybe at the community level, institutional level, or the societal and larger system level. What can people do? What can girls, men, women, and boys, that mixture, what can they do? Is it a matter of maybe attitude change will help the communities' attitude towards violence? What can we do? Is it lighting? Is it more sensitization of the girls in school? The primary prevention obviously forestals the occurrence of the violence. But when we don't prevent, then now we have to respond. And responding is asking ourselves, it has occurred. This young girl, for instance, the case of Julia, she has been raped. So what? Do we just watch on her? Do we just laugh at her and say, it was your mistake? No, we have to do something. And that is a question that even Sarah posed in her presentation. Why didn't Julia report? Because the reporting will lead to response. And that's the challenge we're talking about here. Because if Julia, for instance, reported, she would have received PEP, the post-exposure prophylaxis, for instance. She would have received counseling, psychosocial support, She would have received another medical care immediately. And that is what you're saying here. The secondary prevention that comes as a response because we were not able to prevent the occurrence of the violence or the violent act. Then tertiary prevention, then we ask ourselves, what can we do in the long term so that we mitigate the effects of the violence or the offense that was committed, to the victim. And that is why we may talk about maybe livelihood support or maybe medical rehabilitation. Like in this case, we are talking about Julia with fistula, if I remember well. We need to do something to respond to the impact of that violence. Depending on which case by case, then we're able to know the best way to respond. And different stakeholders, different sectors will have a role in each of these levels of prevention. And that is why we say a combination of the three results in a comprehensive response to gender-based violence. So it is upon us in the panel, the listeners, to identify our space. What are we doing best? Are we good in primary prevention? What projects are we running? What are we doing about secondary prevention? And what are we doing about the tertiary prevention? And you'll find that many organizations or many people in this space of GBV have projects that cut across from primary to the tertiary. It all depends on one's strength, very important. Specific examples of prevention strategies, prevention and response strategies that I may mention is that one, we have to appreciate that there's a connection between the pandemic, COVID-19, and GBV. We have to start with that acknowledgement that there's that connection. It led to an increase in GBV. And then, we have so many programs or response plans for COVID-19, but are they also catering for GBV? When your minister in your country is giving a report on the COVID-19 situation, are they mentioning anything about gender-based violence as something that needs to be responded alongside COVID-19? I thank the Kenyan system of leaders because they have appreciated that, and the president did mention expressly and gave an order for something to be done about the gender-based violence which had risen during COVID-19 period. We need to engage the government on the state and non-state actors, in short, and also include educational institutions, include the gatekeepers, like the traditional leaders, faith-based leaders, so that they can help in sending this message in their spaces, in their many spaces, to say that GBV is not welcome, whether we are in a crisis or not in a crisis, whether we are in peacetime or we are in conflict. So GBV messaging can be passed by working with the state and non-state actors in their different programs. We need to urge institutions, because we are talking about also sexual harassment, which is work-related or workspace-related or professional engagements, so that sexual harassment policies are put in place and they are implemented. And one of those strategies called the good bystander or the bystander initiatives or programs where people can report. For instance, when you see someone being harassed at the bus stage by a tout, you as a bystander, you can raise your voice. That is what we are saying. In the office, if you see your colleague being sexually harassed, you can intervene. That is a bystander approach. So that you don't say it is their burden, it is their problem. They will handle their problem. No, the bystander approach is very important in addressing not just gender-based violence, not just sexual harassment, but all other forms of gender-based violence. We also need to appreciate and use the community-based structures like community policing. In Kenya, we talk about the Nyumba Kumi. Are we using them to report? Are we benefiting because of their presence? And also, what are they doing to curb gender-based violence? Because this is a security issue, in our society. Data is an issue, and the data which is collected, however little it is, we should use it to map the risk areas, vulnerabilities, and so that we can know how to intervene in the best way. It's a question of how are we using this data? Is it just for fun? Is it just for academic appreciation? We should use it to plan. The police should use it to plan, and other actors should use the data to plan, especially to prevent GBV. Technology. Yes, it is something that many countries are adopting now. Toll-free lines, for instance. Ask yourself, in your country, do you know the toll-free line that you can report, through which you can report gender-based violence? In Kenya, if you don't know, you should ask on the site about this line, because there are different of these toll-free lines which are available to us, and they should help us report GBV, and it can help in preventing. If it has occurred, it can help the responders to come to your rescue and help you before it is too late. Smartphone apps, yes, they're being created. SMS platforms and other online platforms, also opportunities that can be used by us in prevention and response. Just ask yourself, at what level are you in your space? Issues of adopting an institutional culture that does not tolerate sexual harassment, zero tolerance. I think that has been, I've mentioned that. Issues of now, there's a gap and a challenge. And I believe this is not just in Kenya. The question of self-shelter or safe houses or shelters or safe spaces, because we are saying report, I will call and say, I've been battered by my husband, I've been defiled by my maybe guardian, and I cannot continue staying here. Where do you take me? The government interventions, are being challenged, and even the civil society interventions are being challenged by this question of, or this limitation of lack of safe spaces or safe houses. We just have about 40 of them in Kenya, for instance. Only 4 are government run, the rest are private. But is that enough? They could just be in urban centers. What about in the rural areas? Where do we take these people for shelter? Even if it is just for temporary shelter of 3 months or 6 months. So that gap is there in our response mechanism towards GBV and other people. Well, do we have spaces or safe spaces to rescue those who are going through gender-based violence? Okay, and then we need to mitigate the impact of GBV, because sometimes it could be because of the economic situation of the survivor that they were exposed, and so they suffered this form of GBV. So we need to provide livelihood support so that they can either pick up their lives and be self-reliant and raise their families. And different civil society organizations are using this methodology or this approach to respond to the survivors' livelihood support activities just to support, starting with the basic things like dignity kits, capital injection, and other even technical training and support thereafter for the victims or survivors to be stable. Okay, so that is my short presentation, just to incite our thinking around the issues of prevention and response, and look at ourselves, our spaces, our strengths, and ask ourselves, what are we doing in prevention and response? What are our strengths? And how well are we synergizing with the people around us, whether state or non-state actors, because we are working for the same survivor, whether you're working for the government program or for a private sector or CSO program, the client is the same person, and we need to synergize and help this person. Okay. Thank you. I know we will discuss more in the last part of this program. Thank you, Albert.
Thank you so much, Dome. I mean, you've given a very good elaboration on the current situation and on situational analysis and the various forms of gender-based violence, including some of the referral pathways. At this juncture, I'd like to welcome Professor Sam Winter, who will give us a multi-sectoral approach to SGBV and response mechanism, because GBV cannot be fought just by one person or one institution. It's a collective effort. So over to you, Professor Sam Winter.
Thanks so much, Albert. Let me just share my screen quickly. Okay, so we've already done introductions as well, and Albert has given a great introduction to what I'm going to talk briefly about today, which is this multi-sectoral approach to GBV response. I'm just going to dive right in. So sort of before we talked about multi-sectoral approaches to sexual and gender-based violence, there was this concept of just kind of isolated providers. So, you know, everybody was kind of operating on their own definitions of what sexual and gender-based violence was. They had their own processes, or they didn't have processes. So there's individual actors in the health sector, there's individual actors in the legal and justice sector, in the psychosocial sector, and in the security sector, as well as other sectors in society that were either attempting to provide services independently on sexual and gender-based violence, but this was causing a lot of issues, right? And it still is in a lot of regions. There was lack of integrated social support and information. A lot of the onus of responsibility in this kind of model, in this independent or isolated providers model, puts the onus of responsibility very much on the survivor. So the survivor has the responsibility of seeking out, for example, health resources or health support, but also, you know, reporting separately to a police station, or deciding whether or not to go through the court system, deciding whether to report, which kind of came up in the Julia case that we heard about earlier. They might have the onus of responsibility for seeking out or finding mental health resources or long-term support, which may or may not be around. So this led to a lot of, you know, multiple repeated visits and confusion about process, delays in services, with each place having different definitions of what sexual and gender-based violence might be. They might be collecting different kinds of indicators or different kinds of, for example, health criteria that may not be presentable in a court if a survivor wanted to report or to go through a court process, for example. So these kinds of separations between providers creates a lot of onus of responsibility on the survivors and a lot of disconnection between these kinds of response mechanisms to provide really connected support for survivors. And so, as Dr. Withome just said, no single actor or agency can really adequately address sexual and gender-based violence on its own, which is sort of the premise of why the multi-sectoral approach came about. So I'll just kind of talk a little bit about what the multi-sectoral approach is. And then I'll go through some of the responsibilities of kind of each section or key institutional area of this approach. So the multi-sectoral approach response to sexual and gender-based violence represents a holistic and coordinated approach aimed at harmonizing and correlating programs and actions developed and implemented by a variety of institutions. So most of the time when we talk about a multi-sectoral approach, it's at a national or a sub-national level. So it tends to be sort of an aggregated response and trying to understand that there needs to be training between all of these different sectors and a harmonizing of these different sectors. There can be a lot of different institutional areas that are included in sexual and gender-based violence response, but the key ones that generally come up in a lot of national action plans, for example, or international action plans include the psychosocial welfare, law and justice, so prosecutors, justice departments, courts, etc. Security, so law enforcement, military, or other security personnel, and then the health sector, which can be quite broad. There's an underlying assumption that the multi-sectoral approach is survivor driven. So this isn't meant to be a process that forces survivors through it, but rather is a function of survivors being able to make choices and feel empowered in this approach. And it is really based on this interdisciplinary, interinstitutional partnership and cooperation. There has to be conversations, there has to be a language and a relationship between these different sectors so that we can provide the best support and care to survivors. It also requires a common philosophy. So an understanding, for example, that the ultimate goal is to prevent violence from happening, and the ultimate goal is to reduce or change norms around violence, for example. And then each sector has unique responsibilities within the multi-sectoral approach, but they also need to have knowledge of what the other sectors are doing so they can better integrate their sort of responsibilities with the responsibilities of others, and they can better know about sort of referral to services, for example, or have a better idea about what different sectors' roles are within this approach. So essentially, this is tying together all of these different sectors. How do we create a common language and a common sort of protocol around how to provide better services that are coordinated, that the referral network is in support, that there's guiding principles around what the goal of prevention and response to sexual and gender-based violence is. And it should include anything from government to private actors to non-governmental organizations and community-based organizations, with sort of, again, this survivor and the survivor's immediate community at the center of this approach. So really centering the survivor. So I'm just going to kind of briefly go through a couple of the responsibilities that have been applied or are talked about in terms of national action plans for each of these sectors. I'm not going to go through all of these, but there'll be the video and there'll be slides available as well if you want. So within the health sector tends to be in the first line of support. So oftentimes when a survivor experiences violence, the most comfortable or the most accessible form of support is the health sector. So that can be, and one of the key parts of the multi-sectoral approach is making sure that medical staff and the medical community are able to provide a medical history and examination, but also really importantly to be able to recognize, screen for, and address sexual and gender-based violence. So do they have the training? Do they feel confident in recognizing and providing support to these communities? They can provide clinical care, urgent care for injuries, or immediate care. They also can provide, or generally do have within this approach, the psychological mental health assessment. So kind of the first line of defense for also psychological and mental health support. And then they provide referrals to other services. So this is where it's really important in the multi-sectoral approach for the health sector to know what each of the other sectors also does. So they can provide referrals to services. One of the key components of the multi-sectoral approach is also to provide services free of cost or at a reduced cost for survivors. So that's one of the goals of a lot of national action plans that have put this approach into action. In the psychosocial sphere. This can include risk assessment, immediate emotional support, as well as long-term emotional and psychological support. So a lot of the long-term action is really centered in the psychosocial. It can also include, for example, educational support, so services within schools or civil society, as well as income generating support. So Dr. Wathomi also talked about that as well, in income generating supports or economic supports for survivors. The legal and justice system. One of the goals, again, of the multi-sectoral approach is to provide free or low-cost legal counseling and representation for survivors. Although, you know, a lot of groups are still kind of working towards that. They also focus on revising and reviewing laws, so trying to enforce laws that protect populations who are at risk and survivors, as well as kind of taking judicial action against perpetrators. They're supposed to monitor court cases, provide orders of protection and safety, and then make sure that perpetrators comply with court-ordered rehabilitation. And then finally, in the security section, this is sort of police, military, other security personnel. A lot of the goals right now with multi-sectoral approaches are to make sure that everybody in these sectors are educated about sexual and gender-based violence. So they have a common definition, they have an approach, they're trained on how to intervene. They have private rooms for reporting to ensure confidentiality. They have same-sex interviewers. So if a male survivor comes in, that they are able to talk to an interviewer who's a male. If a female survivor comes in, they're able to talk to an interviewer who is female or gender non-conforming. And that they have institutional protocols, that they can collect data that's standardized, that can be used. Again, Mr. Wathomi was talking about the importance of that data collection in a standardized way that can be used to help us to better intervene, and then to provide specialized units. So I think I'm gonna stop there. I might do one quick other slide. So one thing, a couple of things I wanted us to pay attention to or to notice is that generally this multi-sectoral approach is national, but it requires input, right? So for example, budgetary and policy commitments. The multi-sectoral approach doesn't tend to work unless there's actual budgetary commitments or a policy commitment to making this work. So a lot of countries have adopted national action plans that integrate a multi-sectoral approach, but without a budgetary commitment, it's very hard to actually carry out the multi-sectoral approach. There's a lot of training that's required, a lot of meetings, a lot of conversations to build those bridges between these different sectors of society. And they can be strengthened with community level approaches like community coordinated care to provide services to folks. And then of course, interdisciplinary and intersector conversations are a core to this. So I'm going to stop there for the sake of time, but I have a bunch of other slides about sort of how we strengthen this approach within the COVID-19 context that I'm happy to share.
Thank you very much, Professor. That was a very well elaborate explanation on the multi-sectoral approach and response mechanisms. I would like to perhaps emphasize certain key points, just for the benefit of the viewers, especially when it comes to GBV. Whenever, and this I drove from the presentation of both Professor Winter and Mr. Wathomi, whenever GBV happens, there are certain things that follow. Either one goes to a safe house or a safe place, either they're going to go and seek medical attention from the hospital, or legal aid is involved, or psychosocial support. So those are 4 key elements that revolve around the ecosystem of GBV. I think it's important that the viewers and participants are aware and alive to that. So at this point in time, I'd like to open the floor to any question or comments from the participants to the panelists. Over to you, participants. Now the floor is yours.
Albert, it can also be an opportunity for the participants to share best practices in their spaces, yeah? Something for the benefit of everyone here. Yeah.
That's very okay. Very fine. Yes. Yeah. So the floor is yours, participants, kindly.
Thank you very much for giving me the opportunity to connect this program from Ghana. I want to thank the two participants, Professor Winter and then Mr. Daniel, for the excellent presentation. My question is, sometimes gender-based violence in the form of sexual harassment, which usually occur in some of our educational institutions, become very problematic to report and dealt with appropriately. This is because there is always an equal power relationship between the victim and then the perpetrator of that unethical or that criminal act. So how do we navigate the process to come up with a very strong reporting protocols that will support the victims, especially the females, to be able to report such cases as and when they occur. Thank you very much.
Any other question?
So good evening, everyone. My name is Margaret Akinyi Atieno. I'm a youth advocate, and I just want to share one of the best practices that we do in the communities to ensure that the victims of gender-based violence get justice. So me as a young person, together with other youth advocates, we normally refer the victims of gender-based violence to the clinics. And we also ensure that we use some of the hotline numbers that we've been given, and that is the one from LVZT 1190, so that the victims can get maybe counseling support. And then there is another one for the government that is 1195, also where the victims of gender-based violence can also report and get to rescue centers so that they sort of get out of the situation that they are in immediately. But my ask in this would also to encourage, maybe if there is the police in the house and any government authority in the house, to probably ensure that the victims of gender-based violence are integrated back in the community, and they're also not discriminated, and the issues of gender-based violence are adequately addressed, considering that the number of, let's say, cases of gender-based violence that are normally reported do take a lot of time based on evidence. So at times you find that the victims end up not getting the justice that they really deserve. And so that is my wish to the government authorities and the police authorities that are in the house. Thank you very much.
Okay, thank you. Maybe we'd want to answer the gentleman from Ghana, either Professor Winter or Mr. Wadome.
Prof, do you want to attend? Prof? Okay.
Although Mr. Wadome unmuted, so he might also have things he wants to say.
Okay.
Wadome, do you want to start? And
yes,
then
yes.
I'll follow? Okay.
Yes, yes. I agree with what Dr. Idris is saying. The issue of sex for marks, it's a common problem across many places, not just in this country. The sex for grades or sex for marks is a problem. The entry point is a question of, does the institution have a sexual harassment policy in the first place? Yes. And how is that policy implemented? Do we have anonymous reporting where students can report, and action will be taken? And again, does this policy have the buy-in and the support of the senior management? Because those are the ones to action and implement the anti-sexual harassment policy. So the entry point is the policy, the implementation and seriousness of the policy, and the victim support mechanisms which are there, because the policy should not just be there to please the students that something is being done. It should be implemented with seriousness. There should be a structure where the victims are comfortable to report and they're happy that they will not be victimized by the lecturers or the administration staff or the people who sexually harass them. So that is my response to that effect. Maybe Prof can add to it. And a practice that I saw at the University of Nairobi, I think I saw they have an app where they can report such incidents. It could be another way to approach this problem, especially in our tertiary institutions. Thank you.
Yeah, I mean, I really agree with what Mr. Withome was saying in many ways. So having really clear policies as well as actual implementation of confidential reporting or anonymous reporting. I love the idea of using an app or using technology in some way that allows for better anonymity and also like a broader accessibility for folks who might have disabilities as well, coupled with being survivors of violence. Also having, school-based supports. And again, this budgetary commitment from the multi-sectoral approach, this budgetary commitment to providing school-based support. So having counseling services, having support groups built into school systems, because school systems, especially for young children, are often that front line of defense for mental health services for survivors. It's often the place where students can get the most kind of support. So making sure that there's that commitment to have those supports within the school and to have training around that. I mean, that's the other thing, is that I feel like we often don't have a lot of training or a lot of common definitions and understandings of what violence is and how to handle it. Especially in the educational setting, it's not something that a lot of people are provided, except maybe at that tertiary level. So having those kinds of trainings as part of the approach to kind of enhancing support and a knowledge of how to intervene or how to create safe spaces for survivors within educational systems. And then destigmatization is always and changing norms is always something that we're trying to work towards. So integrating that into educational programs. That's what I would say.
Great. There's a question here from Gloria, and she asks, how can a victim report a perpetrator whom she cannot remember where he could be found? How can a victim report a perpetrator and she can't remember where he can be found? Because I believe the victim is very traumatized about the whole situation. But what steps can she take, to help herself or to safeguard herself?
Let me attempt, if there is no other question. Reporting, I hope she meant reporting to the police, obviously, Albert. Let me assume it's about reporting to the police. The reason why she should report, even if she doesn't know where this perpetrator is at the moment, because one is for the evidence first collection. Yeah. Because that police can collect before the evidence is spoiled or it cannot be useful in the court process. So, and that will be the basis. Maybe if that person goes and commits the offense somewhere else and they are arrested, then the police will be able to connect, from that forensic evidence in case A, they'll be able to connect with that other evidence. Maybe that was collected after this person was arrested after committing offense on victim number B, So reporting is very important. It is very useful. No one should shy away from reporting any form of gender-based violence, especially for that evidence part of it, because this person may be a serial, maybe rapist, and that will help the police in the future if this person is arrested. And I'm sure the people in the security sector, those who are following us here, like my friend from Uganda, Francis, from the police in Uganda, will agree that it is very important, especially for the forensic evidence collection, which will form the basis in the case of an arrest. And connecting the dots, connecting those dots will be very useful. That would be my.
Okay. We want to add something, Professor Winter?
I feel like Mr. Mathomi was right. I mean, I think reporting, even if you don't know where who the perpetrator was, where the violence took place, the knowledge of reporting what you do know is very, very helpful. They also have, again, like Dr. Mathomi was talking about, depending on the situation, there might be forensic evidence that can help to identify a perpetrator, even if they're unknown to the victim. Obviously, there's a time limit to some of the forensic evidence collection, but there's a process for that. And the other piece is, even if they don't know who it is, and even if the perpetrator doesn't come to justice in the way that we think of coming to justice, oftentimes reporting or seeking support will help you to find other support services, which can be really important. So a survivor might have access to mental health services, might have access to health services they might otherwise not have if they don't report. So even if you don't have a clarity on what happened, which a lot of victims don't and a lot of survivors don't, and a lot of well-trained health professionals, police, security, justice systems know that. They know that you may not have a clear memory and you may not be able to provide all the information, but they can help you to provide referral to services, and they know, they're hopefully well-trained in sort of what the next steps are in being able to provide support. That's what I would add.
Okay, very much. Two more questions. One is a very interesting one. The question is, what is the link between using wood fuel and the risk of GBV outside of conflict situations? I'll repeat. What is the link between using wood fuel and the risk of GBV outside of conflict situations? And the second question, which is directed to Professor Winter, on what are the advantages of the multi-sectoral approach to SGBV?
Okay, now the two questions should be tackled by the two of us. And I'll tackle the wood fuel question. I'm sure the questioner is an African like myself who use fuel to cook, wood as fuel to cook. And Albert, the process of getting wood fuel or firewood, for instance, you have to go to the forest, and fetch the firewood and bring it home, and the forest is a hidden, secluded place. Imagine a woman walking to the forest, deep in the forest, and a man who is an opportunist then obviously stalks the woman to the forest, and they rape them. And sometimes it happens that they even kill such a victim. It has happened in our country and in many other places. And this one can happen in our day-to-day normal activities, which are gender roles. The gender role, now I'm speaking like a gender specialist, that the role of looking for fuel and water is a role assigned to women. It's a gender role assigned to women in the African context. And then men could use that opportunity to attack women in the forest and rape them. This has happened even to our girls. Even people going to fetch water, it has happened. Because some women wake up very early in the morning to go and fetch water, where they have to walk long distances. And so the risk is very high. They're so vulnerable. And a lot has happened, although not reported. So there is that connection between the wood fuel use, collection, and GBV, especially sexual violence meted on women. That is what I can say for now. It can happen in peacetime, it can happen in conflict setups. Yeah. Thank you.
Yeah, I might also, this is not my area of expertise, so I don't necessarily know, but I wonder if, the wood fuel might also tell you something about the home environment or something about socioeconomic status. It might tell you something about a lot of other factors that are correlated to experiences of violence. So it might be a proxy variable in some ways as well. For example, wood fuel is more commonly used in rural areas than it is in urban areas. So, are members of the community well versed in understanding their rights, in understanding definitions of violence and what qualifies as violence? Do they have access to the same resources that folks in the city might have who might not be using wood fuel? So I would look also at sort of what wood fuel might be a proxy for, or like what other indicators might it tell you about a household or about a community that might also be associated with risk of violence. So trying to piece together what are some of the other components that might be at play there, in addition to what Dr. Wathomi was saying about sort of exposure to violence, how wood fuel is a proxy for exposure to certain environments or communities or geographic spaces that are higher violence. And then in terms of, second question was like, what are the benefits of multi-sectoral approaches? So the multi-sectoral approach, the biggest benefit is this collaboration between a variety of different sectors that provide gender-based violence. So like we said, it's impossible for any one organization or any one group or any one sector to solve this issue of violence. Violence is insidious. It affects every aspect of the society and communities. And so, part of it is that every sector is trying to approach this issue in its own way, but having collaboration between sectors is really, really important. So having a shared definition of what violence is, having a long-term goal about prevention and response is really, really important. Having budgetary commitments that can be distributed throughout sectors is really, really important. And then being able to have this knowledge of what other sectors are doing. So the health sector knows how to and who to refer to in another sector, and knows that that sector is trained, right? So if they're referring somebody to a police sector or to reporting or to courts, that they know that the people on that end are also trained in the same way. They know what their mechanisms are. They know that the referrals to services is valuable. So having that coordination, that shared language, that shared goal of sort of prevention and response to violence is really, really important. There's a lot of other benefits to the multi-sectoral approach, but there's like limited time. So I'm happy to follow up in an email or whatever. I'm happy to go into more detail.
Mr. Wathomi, would you like to add something?
Not really. I've just remembered something about the wood thing and GBV. It's a real case study in our country. You see where we have protected forests guarded by Kenya Forest Service. It has happened that women and girls have been violated, sexually violated when they go to fetch water. And so they have to seek authority and permission from the men in uniform and guns. And they're told, now for you to fetch the firewood, obviously we sleep with you. Yeah, whether consent or no consent. We catch you in the forest, we can charge you. Do you want to be charged, or do you want to, pay your way? Yeah, it has happened in our country, and it could be happening in other countries where women and girls have to access firewood in those government protected forests. Thank you.
Thank you very much, Mr. Wathomi. Do we have any, maybe we can take maybe one or two more questions due to our time limitation? Okay, there's a question here. The question is, address female genital mutilation with regards to gender-based violence. That is, address female genital mutilation with regards to gender-based violence. And then the second question is, are safety nets in place to decrease one's risk of gender-based violence? Are safety nets in place to decrease one's risk of gender-based violence?
Okay, Prof, do you want to go first?
Sure. I mean, I can, but if you want to dive in, I know that was part of your area.
Yeah.
Okay. Yeah, you can dive in.
It's a two-part question. Female genital mutilation is a type of harmful traditional practice. Speaking from the Kenyan context, that FGM is outlawed. There's a law that bans FGM in our country. There's a policy also that also is tackling this. There are institutions like we have the FGM board, which is working on eliminating for our our listeners and our followers. The president made an order to eliminate FGM by 2022. If you don't know, 2022 is next year. Yeah, that's a presidential decree in our country. And that is why you saw the other day, the president had to go and meet the gatekeepers in those communities which are practicing FGM to talk to those old men and urge them to be in the front line in eliminating female genital mutilation in our country. That is the Kenyan case study. I don't know about other countries, but I know different countries in Africa now have outlawed female genital mutilation. Yeah, the law is there and the policies are in place. And so it is a form of gender-based violence. Why? Because why are we cutting the women? What are the reasons? You know, and people will tell you we want to tame them, for instance. Why do you want to tame them? Why are you not taming the men? You let the men to go loose like cocks, and then you tell the women you have to be docile and you have to wait for the men. You know, that is why it becomes a form of gender-based violence. Okay, then the question of safety nets in place to decrease the risk. Okay, it all depends on the context. Yeah, are you in the urban setup? Are you in the rural setup? And the basic ones are like life skills training. I saw the other day in one of our informal settlements where women were being trained about taekwondo, you know, how to, you know, some old women are being trained on how to fight off, you know, how to fight off any attackers, you know. And in other contexts, different interventions will be designed to enlarge that space of the safety nets, and especially where people at high risk. And it could include maybe women working as groups, girls walking, being escorted, and other interventions that are being done by different communities in context. Okay, so that is my short response, and Prof can pick from there.
Yeah, again, I mean, female genital mutilation or cutting is not my area of expertise. But a lot of what Mr. Mathome was saying are what I've seen, at least sort of anecdotally and in the literature, as being successful. So these community level interventions where it's about having community buy-in, where it's about having, the elders as well as sort of the enforcers, which are often women or mothers who want success for their children. I mean, a lot of times this is a family value that's instilled in wanting the best thing for a child, but not necessarily, having a conflict, right? That having a child that is marriageable, that is desirable, is in conflict with sort of this notion that female genital cutting is a form of violence. And so having community buy-in, having conversations where, men are willing to marry women who are uncut, families know that or have security that their children will be able to be married even if they are uncut. Things like that, having that relationship building between community members tends to be, at least as far as I know, sort of the most successful strategies. for kind of eliminating or working through or working towards a solution to female genital cutting. Safety nets, I mean, I think that's an interesting question. I think more and more people are developing this idea of safety nets for women. But I wanted to just kind of point to another comment that came into the chat, which is sort of how are we ever going to really address a lot of these things are focused on the response side and not on the prevention. So, that there are safety nets for women who are survivors or men who are survivors and experience violence, but then making sure that there's also prevention. So how are we working towards, how are we working with young boys? How are we working with young girls to talk about how we change the norms of violence, how we change the idea that perpetration of violence is okay, to have people understand that what violence is, and how to deal with it. How do we work with youth around some of these issues? And there's a lot of interventions nowadays that are really trying to focus on that side of things. And how do we prevent, how do we change the norms around violence towards women? And I think it's important to also pay attention to that side of things. Yeah.
Thank you very much. Now, one final question, and I request the panelists to answer it with the shortest time possible due to a time constraint. The question is, religion and culture is misused to promote GBV and other issues. How do we go about it? Religion and culture is misused to promote GBV and other issues. How do we go about it?
I could go first on that one.
Mm-hmm.
I'd say about culture. Some of these practices, like FGM, it happens because for some people it is like a rite of passage. So going back into the community, understanding why they do it, and looking for alternative ways to go about the rite of passage would be a plus. Sometimes, like for FGM, they believe it is a rite of when you become a woman, you're circumcised. So it's a rite of passage for them. Same to the religious sector. The best practice would be to get them involved and talk to them and make them understand why it is not right and find a solution from themselves. So I think that's how we could tackle the issue of abuse within the religious and the cultural sector. Back to you.
Just to pick on where Sarah left, Sarah, my student, I've realized here that the best way to approach the question of culture and the religion, gender issues in an African context are too much tied to our culture. And any change is about cultural change, So what we need is a change of cultural norms. If we cannot achieve that, then we'll have tackled those misconceptions, those lies, those myths about, this is what our religions, our culture says, and also the religion question, because those who perpetrate GBV under certain phrases or certain parts of the scripture or the Quran, they sparingly, discriminately read them. So the clergy can use the pulpit, they can use the space in that religious outfit to also correct that discriminative reading of the religious edicts, so that when they say this, then the clergy can come and say, no, read this and read the other. You don't read what suits you so that you beat your wife. Don't read what suits you so that you defile or rape. No, the clergy should take the lead, and they should take the lead again, even in their behaviors. We have seen cases where, sheikhs, pastors, and clergy of some sorts have been accused and even convicted of gender-based violence, very serious sexual violence, for instance. So let them preach water and take as much water as they can, Let them use their theological and religious knowledge to counter those misreading of the scriptures or the religious writings. And that will help so much. Thank you.
I'll just add quickly that one of the Elam Trust and Dr. Julia Kugunda, who couldn't join us today, but is sort of part of the sponsors of this call, does a lot of work with religious and spiritual leaders, community-based work, training around sexual and gender-based violence and how to move forward as a collective, involving them in the movement of sort of preventing of sexual and gender-based violence. So if you're interested, I would check them out. So that's Elam Trust and then Dr. Julia Kugunda. They're doing a lot of that work in Kenya. So it might be a way to look at some of the community-based intervention approaches to that.
Okay, thank you all very much. Unfortunately, we've come to the end of today. I know this is a very engaging discussion and there's so much to discuss. But my hope is that we've been able to pick on something, especially when it comes to GBV. I know in a better position to understand what GBV is, the various forms of GBV, the prevention mechanisms, and how to respond to it, including the types. And I know you'll be able to reach out to the various panelists as I think through the chat box. I believe their contact details are there. For me is just to implore on all our viewers and our participants to be champions on GBV. This is something that we witness on a day-to-day basis. Let's not be complacent. Let's step up and do our part. At this point in time, I'd like to hand over to Lillian. Lillian, the floor is yours.
Thank you, Albert, for such a great work. And thank you all for participating in this webinar. We hope that you enjoyed the presentation, and I would like to express our appreciation to all the panelists for your invaluable contribution in making this webinar a success. My deepest gratitude also goes to our audience, to whom we sincerely value your support and participation. And again, we hope to see you in our next session of the series, as well as other webinars in the pipeline. And to get the latest updates, do remember to follow us on Facebook and Twitter, as we have posted, at CGC Nairobi, and Instagram, cgc.nairobi. And with that, I would first want to say pole to Mr. Francis Okwen that you were not able to share your experience at this point, but I believe you'll get an opportunity in the next series. We can give you an opportunity to present your, would like to hear your experience about the, at the ground level. And with that, I would like to say a big thank you. Have yourself a splendid evening, and bye.